Susan Lattimore, who's the regional director of the Mountain States region located at OHSU in Portland. Just have to accept the recording. Okay. All right, so the agenda for today, we're going to be going over the importance of our PSS survey, as well as having a nationally uniform survey for our HTC networks, and then also the findings from our prior 3 survey iterations. And then I'm going to turn it over to my colleague, Susan Lattimore, who's going to cover our current survey questions, as well as our overall timeline for the 4th PSS, and implementation, as well as how we're going to share results and any conclusions, and we'll take some questions at the end. Okay, so we want to go over the background for the why we decided to come together with come up with this survey when it was implemented about 10 years ago now. So there's a growing evidence on the importance of patient satisfaction to good overall health. And some studies suggest that higher patient satisfaction is associated with shared decision-making. In addition, having positive interactions between patients and physicians contributes to higher satisfaction. In addition, patient satisfaction is a key quality metric that has been associated with better treatment adherence and overall outcomes as well. So our national PSS, when this came to fruition, we always want to give credit to our regional administrators who are now retired, Judith Baker and Brenda Risky, that were as well as the rest of our PSS steering committee that really helped lift this off the ground. So having a standardized and nationally uniform survey can help us look at nationwide trends, especially in the bleeding disorders community. We also wanted to really capture the patient voice, and how has the HTC model impacted them or the patient and their care, as well as what are the concerns and barriers to care that patients have reported. And in terms of metrics, HTCs are, as being a federally qualified hemophilia treatment center, they are required to uphold some HRSA grant priorities. And some of those that we've looked at and have been trying to map out, especially for the nation, are access to care, patient experience, adolescent transition, and the overall effect of the 340B program to the HTC model. So we've broken up a couple different categories. So with satisfaction, we look at the overall satisfaction, as well as the core team of an HTC, which the MASAC guidelines defines as a physician, a nurse, a physical therapist, and a social worker. And there's also an extended team as well. So in addition, we're looking at the services and processes. And on the other side, we want to look at we look at barriers and problems that patients experience in a couple of different categories that you'll see on this survey, as well as prior surveys, are insurance, language, COVID-19, and for this iteration, we've added a question on distance. Okay, so this slide that you see on your screen details the metrics and sources that we used in compiling our initial survey that started in 2014, and we've made some updates as we will go over. The items that you see in our survey questions are derived from the CDC's National Survey of Children with Special Healthcare Needs, as well as the consumer assessment of healthcare providers and systems. And in addition, Healthy People 2030 and Healthy People 2020, going back a decade when we first started this survey. And one of the objectives in Healthy People 2020, as well as a required HRSA grant measure, is adolescent transition. Additionally, we looked at the Center for Medicare and Medicaid's Accountable Care Organization quality measures. And we show each on the screen how each question associates with those metrics. So now we're going to briefly go over the last previous 3 iterations. So as you can see, in terms of participation, our HTC participation has remained high. And this is comparing over the previous three time periods. So overall, in our 2020 survey, we had 133 of 144 national HTCs who participated. That's 92%. And then over 5,300 patients or patient caregivers participated in the latest survey, which is a large number, especially for a unified rare disorder survey. And it's a larger participation, three surveys, which especially if you look at all the way to the right of your screen, we had over 5,300. That this was during the the onset of the COVID-19 pandemic. So kudos to HTCs and patients for their participation, especially given all the challenges that we've all gone through. Okay, and then in terms of overall satisfaction over this survey, it's maintained consistent or even increased during the PSS3, as you can see. So another kudos, and that's something we through. I know Susan will go over, how we disseminate our data, but these are the kind of things we really like to talk about. Okay, so in terms of demographics on the third national survey, which was administered in 2021 again for care in calendar year 2020, we had 19% were non-white participants, 32% were females, 13% were Hispanic or Latino, and then 28% had VWD. And so this is kind of a nice overview of who participated during that time. And in terms of the care in 2020, how did the patients and caregivers relate satisfaction with HTC staff? And that remained high. So it was anywhere from 97.3 to 98.1 of patients responded that they always or usually were satisfied with HTC staff. And the question was, how would you rate your level of satisfaction for each provider? So this slide looks at the care received in 2020, the HTC processes and surveys, processes and services. And that was all rated at either 93%, which was the coordination of care, all the way up to 98% with spending sufficient time with staff. So as you can see, this is, we'll show on other side, but this maintained consistently or higher going forward. So that's another testament to the great work that our HTCs have been doing in the eyes of patients. Okay, and this slide looks at the three time points when it comes to adolescent transition to adulthood. As you can see, satisfaction increased over time. And again, this is a HRSA grant measure that HTCs are required to report about as well. And the two questions that were asked were the one on the right, one on the left that is in gray. That's how often did you talk about care for bleeding disorders as the patient becomes an adult? And then the second one is how often did you encourage your patient 12 to 17 to become more independent in managing bleeding disorders? And just to keep in mind, this is only for patients 12 to 17. Okay, and then the next two slides go over barriers. One of the barriers that we've asked about in all three surveys so far is insurance. And as you can see, always has gone down quite substantially. And then if you go all the way to the right of the slide, never's gone anywhere from 63% to our last survey saying 84% said that insurance was never a problem getting HTC surveys. So it shows a great work in the insurance landscape, how it's changed. But something to keep in mind when we go to the sometimes category, we still have 2020 13% saying insurance was sometimes a problem. So those are things we keep in mind. And these are things that we share data with the public, with our federal partners, And it's something that we try to keep in the back of our minds as we go forward with future surveys. And then language, that also drastically changed from the first survey, where only 0.3% said always that language is a problem in 2020, down from 19.1% in 2014. So those numbers pretty much speak for themselves. So I'm going to turn it over to Susan Ladmore, who's going to cover the rest of the presentation from here.
Thanks, Kaveh. So here's just a snapshot of how the PSS is organized overall. I'm not going to read this to you. I think we're going to touch on most of these pieces, but this consistently has been organized through a steering committee that's made up of regional administrators and directors, people from the core center at University of Colorado who hosted and coordinated the first 3 surveys, and people from OHSU who are coordinating and hosting the survey this year. So thank you to all of you, and we'll talk about a few more of these things as we go forward. Kaveh, next slide, please. So here's a snapshot of the current survey. This is PSS 4. So we'll keep calling this PSS 4 as we move forward, the 2024 survey. Oh, I like that. I didn't even realize it was the 4th in 2024, but on care that's been received by patients in 2023. This is the front page of the survey. It's a 2-page survey on the paper form that is identified at the top of the survey with your specific HTC number and name. And the survey is broken down in a couple of different sections. The top section, it has demographics that are no PHI and not identifiers. There's a section for specific satisfaction questions. So asking questions like Kaveh referred to about staff, services, and care received. And then additionally, the closing section has questions about adolescent transition and barriers to care. The survey concludes with an open section for comments. So any free text that a patient or family or caregiver wants to provide, they can certainly provide that in the free text section. Next slide, please. Again, on the paper forms, there's identifier at the top that'll just give you the HTC number and name. So when we receive them back at the core center, can allocate those survey responses back to the appropriate center. On the online version of the survey, patients will see a drop-down when they access that survey that's listed by state. So they'll choose the state that they live in, and then they'll have all of the treatment centers that are available from that perspective. Alternately, patients can search within the state that they're going to receive care. If for some reason they receive care outside of the state that they live in, but it has state and HTC name, and these names are provided by all of you at the HTCs as the patient-friendly name that they would most quickly identify with. Next slide, please. Here's just a walkthrough of kind of the lifespan of the survey. I'll talk a little bit more about the paper survey here because I think that is a little bit more of a walkthrough. Surveys are sent to the HTCs. We'll again mention a little bit more in depth about this as we go forward, but the survey information goes to the HTCs from the regional core center. Data collection goes out from the HTC level. So HTCs do thankful work of preparing all of the surveys to be distributed and then are disseminated to the applicable patient group. The patient sends the completed survey back to the Patient Satisfaction Survey Coordinating Center at OHSU through a pre-stamped envelope where they fill out the survey electronically. The data analysis and entry happens at the coordinating center. So all of the paper forms that are received in English and in Spanish are entered into the REDCap database manually. So we make sure that we're collecting exactly what the patient or caregiver has reported on the PSS. And then the data gets analyzed at the HTC level, the regional level, and the national level. And then that information is in turn distributed to all the HTCs, regions, and then it's aggregated to the national level. And again, we'll talk a little bit more about some of this as we go forward. Next slide, please. So here's a snapshot of the project timeline. we don't have to go back in time, which is great, because we're starting fresh. But we're here in this purple space where the survey's been designed and redesigned by the committee. We've received Spanish translation, and the materials have all been prepped for this iteration of the PSS4. The survey information and all of the materials should have come to HTCs from your regional core center. We're moving things forward in a different way than we have previously. In past iterations, we've sent documents directly. That's sometimes complicated because documents via email often get quarantined by institutions that have multiple attachments. We've tried Dropbox in the past, which works for some people and doesn't work for others. And so this year we're using OneDrive, a Microsoft tool to be able to house all the specific documents for each HTC. And we'll touch on that again in a minute. But those materials should be in your hands, and you've come to this survey. So you know that, I mean, sorry, to this webinar. So we know that that information made it to you. We're looking for a February 1st launch. So for the surveys to be open for patients and caregivers to be able to take the surveys online starting February 1st, and for that distribution of surveys to go out to patients and families from your HTC directly. And we'll keep the survey open for about 4 months. We're tentatively saying that we have a May 31st closure of the online survey, but we found that in past surveys, we've had to remain flexible about this. It really just depends on how all of you can incorporate getting surveys into patients' hands. And so that distribution sometimes has some delay on one side or the other as far as when surveys are distributed, and some of that depends on other factors that we'll talk about in a second. But we'll also have some flexibility to say if we're still getting a large volume of surveys that are incoming, we can push this timeline out just a little bit. We'll have data processing happen over the summer. So it takes some time to make sure that we're quarantining data that's potentially identifiable, which is what we're keeping true to this being an anonymized survey. And then making sure that we're cleaning and scrubbing the data. And then our hope is to get data disseminated back to regions in September for by October or so, we can have data back in your hands that's at multiple levels. Next survey. Sorry, next slide, please. So here's a little checklist for regions. Thank you for the work that you've done already across all of the regional core centers to be able to have survey materials out. And we're obviously here for this webinar. February 1st, the surveys officially will go live. And then we're going to really run a lot of the communication about the PSS for progress through the regions. So we'll ask the regions, we'll check in with HTCs and provide some status updates about, you know, have the surveys left your center? How many surveys have we received at the core center that are representing your HTC? And we'll be sure that we're sending those updates back out to you through the regions. We'll make sure the regions are communicating the survey closure date if that changes in some way, shape, or form. And then in the fall of 2024, we'll work through the regions to distribute and review the results with HTCs. Next slide. From an HTC standpoint, things look pretty similar in January and in February, because time is time. We'll submit, the information should be in your hands. If you are required to submit for an IRB waiver, if that's applicable at your center, please do so. And we'll have that be the first thing that you take on and do. You'll need to personalize some of these documents, which we'll talk about in a second, and get the surveys actually in patients' hands. And then really things move through about the same as the previous slide, officially going live with the survey, promoting the survey in clinic and encouraging online completion, the end of survey promotion, and then receiving results in the fall. Next slide. So documents that you should receive or should have received, or someone at your center should have received. I guess I should have prefaced to say that in the fall, we sent out a request from the core center to all of the regions to communicate with HTCs about primary contacts for this work and the HTC name and number that you want reflected on your surveys. So if for some reason the primary contact that's been identified or contacts that have been identified are not the correct people, you'll see at the end of this presentation where you can reach out to have additional or more people connected to those folders to be able to see these materials. The surveys are available in English and Spanish. They're PDF forms that sit within that folder. They're personalized with your name and number. There's a cover letter that accompanies each of the surveys that explains the surveys to patients and families and caregivers so that they just don't receive a blank form, but they understand the intention behind this. This has been consistent with previous iterations of the survey. The cover letters have to be personalized for your HTC though. So you'll see on subsequent slides what I mean by that. There's an administration manual that's in there that probably answers a lot of the questions that you have right now, and we can certainly take some time at the closure of this webinar to answer some of those as well. But please take the time to move through that administration manual. There's some great stuff that's inside of there, and it's a good reference for you if you have additional questions. The IRB determination from the Oregon Health and Science University IRB that this was non-human subject research and that it was exempt from oversight is also included in there. So if you have to submit this to your own IRB, you can use that documentation to help support that. And there's a whole folder full of promotional materials. Next slide, please. So this is what it looks like. I'm just showing you the slide for our own center here, but you should all see something that looks identical to this. The folder will have your number and your name at the top, and it will have the promotional materials. It will have all the documents that I just referenced that sit within that folder, PDFs and Word documents if the document needs to be modified on your side. Next slide, please. The administration manual looks like this. It's a couple of pages long. It has just some clarifications around eligibility, mailing, funding, IRB use. It has some FAQs on the back. It has a little history of the survey itself and is a great reference. It's most of the content that we're including in this webinar. Next slide, please. This is what the cover letter looks like when you open it up in the Word version. It has a note at the top that you're going to need to remove. It says remove this text before printing. Just as a reminder, it's there. The highlighted sections that sit within here all need to be specifically entered with however you want your HTC name to be represented. And then at the bottom, however you want the HTC to be signed on this letter on behalf of you or in general or whatever it is. Next slide, please. And then you can see in here, we've added several pieces to this cover letter to make sure that we're promoting the online use of the survey. The fewer paper forms that we get back, the less work that is on the other side of this to enter that data. So we're reminding patients in multiple locations where they can go to complete the survey online at htcsurvey.com. And then we've added a QR code at the bottom of both the English and the Spanish cover letters for people to be able to just take a quick snap and be able to link to the survey directly if they have the technology and ability to do that. Next slide, please. This is just what the Spanish language version looks like. I've put it on letterhead, and you too can do the same thing with yours. Next slide, please. In previous survey iterations, Athens has helped with this project to be able to create a distribution list in Clinical Manager that allows you to understand, like, how do I figure out who the patients are that I should be sending this to you? The survey is for patients who have had a meaningful two-way contact with the center in the year 2023. So it's the same list from a bleeding disorders perspective as patients who are included in the HTDS for 2023. This list will give you a report. This report will give you a list that you can use as a guide for who to include survey distribution to. Even if you don't have addresses entered in Clinical Manager, like I know many people don't enter an address into Clinical Manager, like a full address, or maintain that, but at least you can see a patient list and it'll give you the things that are located within this piece down here that it gives you your clinical manager ID, the first and last name of the patient, the mailing list or mailing address or whatever mailing information is there for people who have a primary diagnosis of a bleeding disorder that are included in the 2023 HTDS. So within clinical manager in the reports section, you'll see that it looks like this within production. And next slide, please. Within production, you'll see that there's a report that says patient satisfaction survey contact list for 2023 eligible patients. You can just click the run button. It'll populate this filter that will already give you the whole of 2023 to be able to run the report against. You can click OK and it'll generate that. If you are somebody who doesn't work in clinical manager, or you're somebody who doesn't know how to or do reports, find your person in your center who can do that for you if that's something that you're looking to do. Next slide, please. Here are some great tips of things that we've learned now on the 4th version. We're really like honing in on what makes this successful. Our advisement is always to mail a cover letter and paper survey to all eligible patients. Even though we're in 2024 and there are many people who love technology and are very facile with using technology to complete surveys and to do this work, the last iteration of the survey, there were 63% of the survey respondents that we had were paper forms. So that really speaks back to patients and caregivers are using this paper forms. We want to make sure that it gets in the hands of every eligible person to be able to complete this. Although we have the same type of reference on the cover letter that said, go to htcsurvey.com and take this survey, it was clear that there were many people who prefer to just complete the paper form. So please make sure that you're sending the cover letter and paper survey to all eligible patients who are on that list. Please include a stamped return envelope with the coordinating center address. The address is here, but it's also in the manual. It's at the bottom of the survey. There are lots of places that the address is listed and located, but if you have questions, just reach out. But please put a stamped return envelope with this address pre-populated for patients and families. You can use the report in clinical manager to identify the people to include. So that is there and it's available for you if that helps things. Please do not use metered mail envelopes or business reply envelopes for the return envelope that you're providing back to patients and families. We found that unfortunately, we missed several responses because people were using this to return surveys by obscuring the address and contact, like putting a mail label over where it says your company name here. But the US Postal Service won't take a business reply mail that's been edited in any way. And we don't want things coming back to you directly at the HTC because we don't want anything that's potentially identifying to come back to the centers directly. So if it's coming to the coordinating center, we can quarantine any potentially identifiable information that's coming back to you. And I think that's where we have the crux of the challenge here, that surveys coming back directly to the centers potentially opens some identifiers that we're trying to avoid and keeping true to this being an exempt project. If you're collecting surveys in clinic, and I know that this has come up several times in the past, if you're collecting a survey in clinic, it's your obligation to make sure that you're providing a sealed envelope for the patient to put that information within, and that you're not editing that in any way, shape, or form before it's being sent back to the core center. So this has been an effective way that people have distributed the survey in the past, in addition to providing a mailed copy to patients and families. I guess twofold from that perspective, assuring that it's a patient that had two-way contact with the center in 2023 so that you're not giving someone a survey that wasn't eligible. And then making sure that, again, if you're giving the survey to someone to complete from the paper version side in person, please give them an envelope that you tell them to seal and that you're not altering, editing, or opening in any way, shape, or form. The easier part of that is to connect them to the online survey if you're asking about doing that in clinic, so that people have the opportunity to directly enter that info and then close that survey, and then we're done with that from there. Next survey. I'm sorry, not next survey, next slide. Every time we've used the primary website for the patient satisfaction survey, which is htcsurvey.com. It's a great website. I'm a little biased. It's a great website that has a ton of information on it. So it's publicly facing. You can see it. Patients and families can see it. Chapters can see it. Everybody can see this website. But it has a lot of great information on it that has information about surveys that we've done in the past, frequently asked questions about the survey, contact information for the survey, information about the steering committee. But it also has this header that sits on it now that says new national survey coming in 2024, so that people are aware as they're getting this that the survey is coming and it's going to be available. Next slide, please. And then when the survey is open, it's not on the website yet, so I just mocked this up. It's going to look much more beautiful than this when it goes live. But there'll be a button that sits on the top of this that says, take the survey, because we've obviously on the cover letter referred people back to htcsurvey.com to be able to connect to the REDCap survey. And so that will sit on the top of this page for the open survey period that says, take the survey. We'll have it say, take the survey in Spanish and in English. People can just click on that button and they can get directly linked to the REDCap survey. Next slide, please. What will happen after that? So after that, we'll share results. Regions and HTCs will receive results. From a HTC perspective, you'll receive results that are all of the data that is from your HTC reported on behalf of your HTC. You'll receive all of that data in full via Excel file. You'll also receive a basic report that will compare your HTC to for each question, it will compare your HTC's percentage of satisfaction or percentage of barriers and demographics to overall regional comparators and to national comparators. And you'll also get a full open info of the written comments. From a public perspective, we'll share this information on the HTC survey, and we'll look a little bit more at that as we go forward. So can you just go to the next slide for me, Kaveh? So this is a little bit what the basics report looks like. This is just one section that sits within that. But like for question 9, how often was insurance a problem getting the HTC services you needed? It'll show your HTC first. It'll give you a breakdown across all of the eligible responses. It will compare that to the regional information, and then it will compare that to the entire country's information. So you can see really if this is a barrier that's unique to your own center, or if this is a barrier that really is the population of respondents have received. And this is for every question that is a part of the survey. Next slide, please. And then you'll also receive, like we said, sort of this open Excel file that has all of the comments that have been received. These are comments that were filtered a little bit in some of our analysis, but we're not editing the content in any way that someone has sent. The only thing that we have potential to edit is something that could identify the individual who's submitted that comment. So if it said, Joe Bob has a lot of trouble with X, Y, and Z, we would just quarantine out Joe Bob, and we would put in parentheses the patient or something else that holds that space, and it would be the only quarantining that we do of information from there. Okay, next slide, please. So again, sharing these results broadly, right? Why wouldn't you want to share all of the great work that's been done? If you looked at the first slides that Kaveh provided, it's astounding how satisfied overall that patients and caregivers are with the care that they're receiving. We really want to promote that information. So here's some of the ways that we've promoted this in the past on the htcsurvey.com website. We've had little one-pagers that we've had that show all of these different topics that we touched on from last survey iteration, and we anticipate doing the same with this current survey once we get to that point. Plus, we've also presented posters at national and international conferences, regional conferences. We've held webinars with stakeholders that are interested in this information, but also representing all of the hard work that you all do and the ways that patients and families are receiving that work. And then we have a second manuscript that's underway currently looking at satisfaction across the first 3 surveys in total. Next slide, please. So in conclusion, there has been a high response rate for this survey. For a survey that doesn't have any reminders really and doesn't have any intentional sort of walk back to patients and families once it's distributed. 5,300, over 5,300 patients represented in rare disease is phenomenal. So thank you so much for helping support this work. There's been incredibly high satisfaction with HTCs across the US, and it really is such a testament to the care that HTCs are providing, which really results in improved health outcomes for patients and families. The PSS4 specifically, the online survey launches February 1st. The goal is really to have paper surveys mailed out to all eligible patients in the month of February 2024. If you want to do it sooner, great, fabulous, do it in January, but really to have the survey in patients' hands by the close of the month in February so that we can really get responses back in earnest. The more that we distance ourselves from 2023, the harder sometimes it is for patients and families to reflect on that. And so we've really moved this up a little bit in the year to make sure that we give people the opportunity to respond quickly about the care they received in the last year. Survey period will close around May 31st, and then the results will be back to the HTCs in the fall of 2024. The PSS results really inform survey modifications in the future. And so if there are suggestions that you have, if there's something that is not ringing true to you, if you have edits that you think would be things for us to consider, please reach out. We welcome any type of feedback that you have. If there are things that you're finding that are barriers for patients and families that we're not picking up in the survey, certainly we would love to think about considering that next time around. So please just reach out. Next slide, please. There are so many people, groups, things that make this survey possible. And I can't call out everyone on this slide, but I really want to say thank you in particular to patients and parents and caregivers really for completing this survey. It to me has been a great way to lift voices of patients and families and to really understand the patient experience. And thank you to all of the treatment centers. I understand that this is a lot of work. We do it at our own center. You know this is the 4th time that I've been able to be involved in this survey. And it doesn't get any easier, but I think in the long run, really having this information to stand behind is worth the work that we put in. Thank you again to the Hemophilia of Georgia for supporting the Spanish translation. We did make some edits to the survey this year. And so for them to be able to get the survey translated and reformatted and to be able to get the cover letter translated is such a big help. So thank you again to them. Next slide. Questions. So I think one thing that I failed to mention that I really want to lift one more time is, as Kaveh mentioned on one of the first slides, this survey helps support many of the grant goals and objectives for our HRSA award currently. adolescent transition, use of 340B, patient and family engagement, patient and family voice, barriers to care, access issues. All of these things fall within the scope of the HRSA award. And so this is a great opportunity to be able to use program income, if you have it, to be able to pay for supplies, mailing, stamps, etc. It's certainly an allowable use of program income funds. If you are challenged and don't have funds for some reason, please reach out to your regional core center and they can help figure out how that can be navigated. That was the one thing that I forgot, so I just want to make sure I mentioned that. That's all.